All right. It looks like most people have been able to make it in from the waiting room. I'd like to welcome you all here. Thank you so much for being with us. We're excited to bring you another in our webinar series that we started last fall. Very nice of you all to be so prompt and on time. My name is Wendy Vendrelo. I'm the executive director of NAPSA. I've been with the organization since last August. Looking forward to celebrating 1 year of service here very soon, and also looking forward to our conference that's coming up in Atlanta in September. Hopefully, you've been seeing a lot of the information we've been putting out about that. Registration is open. We actually have a registration for larger groups, so people that are registering 20 or more people in their organization. We have a discount that's running right now through June 30th in case that applies to you. Otherwise, we are in the midst of early bird registration, which will go through just toward the end of July, and been having some great response. If you haven't already and you're wanting to come, please register, and we were excited to see you in Atlanta. Couple other housekeeping things before we get started today. Again, as I mentioned, this is an ongoing webinar series that we started last fall, and I just wanted to draw attention to our next webinar that will follow this one. That is on July 9th at 1 p.m. Central Time. And you'll notice the people that are going to be doing that. You've seen them before. It's another in our series from the NAPSA standards that were just revised at the end of 2024. So Spurgeon Kennedy and members of the commission that revised those are going to be doing that on July 9th at 1 p.m. I will put the registration in the chat here in just a moment, so you can look for that there and join us again in July. Couple other things. Let's see, I already talked about the conference, but again, bears repeating. We are registering now for conference. One thing to point out, we have an extra leadership event that's happening on this Sunday before the conference officially kicks off, and that is filling up quickly. I actually anticipate that by the end of this week, perhaps, or maybe next week, we're going to be at least 2/3 full, and that does have a capacity. So if you are thinking about registering for that, please do so soon before it fills up. But otherwise, just wanted to talk and kind of change the topic to today's session. You'll notice that you have access to the chat, and so I think it's great. There's been so many people saying hello from all over the country and all over the world. I know we have some folks that often attend who are not in the United States, and so we welcome you, especially here. So feel free to chat with one another. Feel free to chat with the facilitators of this group or this webinar today. And then also the one thing I wanted to point out though is if you have a question, it is easier for us to answer and for people to see the answers if you put the questions in the Q&A. So you'll see also by the chat that you have the Q&A function. So if you could put questions there, we would greatly appreciate it. Now turning to the session today. So incorporating supportive services to promote pretrial success. This is based upon the NIC publication series. I'm also going to be putting those in the chat. So look for those there. I want to say a big thank you to our partners at NIC who for many years have been our partners in collaboration in this work, including on this series. And just to say a special thank you to Ken Rose, who had until recently been with NIC, and it was actually his idea to have this webinar today. And, so this was his brainchild. And so we're saying a special thank you to Ken, who continues to be a great partner and a great friend to Pretrial. So with that, I'm going to allow our faculty to introduce themselves. And so we will start off with Domingo.
Hi, everybody. My name is Domingo Corona. I'm the Director of Pretrial Services in Pima County, Arizona. Tucson is our largest city. In addition to my role with Pretrial, and I've been with Pretrial for 27 years now, I'm also a member of the Pretrial Executives Network with NIC and also a board member for the NABSA Board of Directors. I'll hand it over to Sarah.
Thanks, Domingo. Hi, everybody. I'm Sarah Phillips. I am the Pretrial Services Supervisor in St. Louis City, Missouri. Very excited to be here. I've been with Pretrial for about 5 years. My background is in social work, and I'm really excited to talk to you all about this today. I will pass it over to Hillary.
Good afternoon, everyone. My name is Hillary Hartoin, and I'm the Director of Court Services in Cass County, Indiana. I've been working in the pretrial field for almost 10 years now. Along with Domingo, I'm a member of the NIC Pretrial Executive Network, as well as the APPR Penn, and a new member to the NAPSA Education Committee. And this is a topic that a lot of us in the field are really passionate about and excited to share with you today. So with that, I'm going to just kind of kick it off into the webinar, into our objectives and what we'll be talking about as we move through our time together. First, we're going to just kind of introduce you to the success-based model of pretrial supervision and how to work with your stakeholders to begin implementing a similar model for your jurisdiction. So this is just kind of introducing the publications that Wendy mentioned earlier. You'll learn how to incorporate voluntary support services to improve outcomes within the unique legal requirements and framework of pretrial supervision and without compromising the presumption of innocence. And it will really give you a good, diverse overview of this growing shift in the field from more of a compliance-based model to a supportive model of supervision. And then you'll get to really see some highlights from both rural jurisdictions and urban agencies and the impact that they've had. So to further introduce the supportive services model, I kind of wanted to start everybody out with a quote from the NIC EBDM framework. This is one of Ken's favorite quotes, and that is that every interaction within the criminal justice system offers an opportunity to contribute to harm reduction and to support successful outcomes. And that's really what a supportive services model of pretrial supervision is all about. And here are the three publications that we are referencing today that the NIC Penn and NIC had worked on over the past few years. The first publication is Court Non-Appearance and New Case Filings, and that's really redefining pretrial misconduct and looking at when someone is unsuccessful, the real and true drivers of what's going on there. The next publication is what we're talking about today, incorporating services and support. Is there a best model? And then the last one is promoting pretrial success, a new model of pretrial supervision. So we'll talk a little bit about pieces from each of those publications today as we move forward. And I will highlight that they will also be available within hopefully the next week on the NAPSA website. With that, I'm going to give it over to Domingo to talk about the NAPSA standards.
Yeah, and so for those of you that are not familiar with the NAPSA standards, as I mentioned, now I'm on the NAPSA board of directors, and I was also privileged to be on the member of the writing team for the 2000 release of the standards. But I do kind of want to, direct everybody to those standards. If you get a chance, if you're working in pretrial or you're running a pretrial program or aligned with a pretrial program, to, use those as a guide, as a best practices guide if you need to. One of the standards I wanted to you to take a look at in reference to this entire discussion is standard 4.2, which talks about policies. And really, what I would like to point out is the section that talks about the fact that behavioral health treatment should be voluntary. And I think that's an important thing to note. If you're working with supportive services, that supportive services based on NAPSA standards shouldn't be something the court imposes or orders. It shouldn't be something that's ordered during the pretrial phase as a condition of release. It sometimes does end up that way, but I just want to point out the standards say we should make those services voluntary. Next slide, please. So introducing the intervention services model for pretrial, I do want to, I'm going to go over these, but then I have a couple comments on them. So success-oriented pretrial intervention should integrate or supplement pretrial supervision with support services. The way I would interpret that is that, supportive services should help you mitigate risk, which we'll talk about. But you really should have important aspects of your supervision that are evidence-based, such as having court date reminders for individuals. So, having those core evidence-based programming elements in supervision is super important. Having the supportive services assist you with having people get to court or remaining arrest-free, That's really the focus of a supportive services model of pretrial supervision. Providing or referring defendants to interventions such as substance use or mental health treatment, vocational services, or housing assistance is part of a supervision strategy. So in other words, we've had conversations locally in Pima County about what, and I'll get into that here in a little bit. Should like the handoff, should that treatment be the focus of a pretrial program? And no, that should not be the focus. That again, that should be something that's one of the things that you're doing to address success with pretrial. The next thing is we should achieve positive outcomes. And the thing about that I like to stress is in pretrial, we should remain focused on what successful pretrial outcomes are. People going to court, people remaining arrest-free. And we'll get into this later, but we were very careful not to say if someone went to treatment and adhered to treatment, that's a measure of pretrial success. That's not an evidence-based practice for pretrial release. Again, that's something that supplements your program. And once again, and again, this aligns with NAPSA standards. Participation in services should be always be voluntary. Next slide. So mitigating risk versus reducing risk. So R&R, risk needs responsivity, is used as a mitigation strategy to increase the likelihood of pretrial success and reduce recidivism in a support services model. What I would stress with that is that an R&R shouldn't be a gauge to determine who gets released pretrial, because I've been part of conversations where we talk about an R&R being used to help determine who should be released. That's not, I think, what we're advocating for here. An example is we use the PSA court tool in Pima County. That's the measure for release conditions. R&R should help, again, guide you when you're supervising somebody and what kind of strategy should you employ in that zone. Next, the goal of a supported model of pretrial supervision is to employ mitigation strategies to help pretrial participants succeed. What is success, right? So we're trying to help people be successful if they have barriers. We need to keep in mind, what success is, and that's going to court, remaining arrest-free. It's not to complete treatment. And how do we reduce the impact or likelihood of risk? Finding ways to take action to improve the likelihood of success despite the risk involved. I think one of the key aspects I like to keep in mind, and again, we all have different perspectives, but one of the things that I think are important to know: what are your jurisdiction's resources? What is the risk tolerance your jurisdiction has for releasing individuals? I think those are things, as you're aligning with best practices and you're incorporating success supportive services, you need to keep those things in mind so we don't set individuals up for failure also. So we're asking people to do different levels of treatment, and it's not in the community. I think that's something that needs to be a very engaging conversation with your stakeholders. And then how do we shift from identifying risk factors to barriers to success? Employ R&R to address needs to mitigate the risk of misconduct and promote positive pretrial outcomes. So I think that R&R, should, like other pretrial screening methods for supervision, it should highlight challenges especially in the area where supportive services are useful. But I think we should all still be mindful of other barriers that exist. In other words, the R&R is a tool to help you with mitigating risk. And reducing, risk, can be across several ways to assess an individual. And with that, I'll hand that over to Sarah.
Thanks, Domingo. Okay, so we're talking about risk. I know that in my jurisdiction in St. Louis, judges are really concerned about risk, as they should be. They should be thinking about that. But the question that we should be asking as pretrial practitioners is around what kind of risk, how much risk is there? And so we know there are tools out there, as Domingo mentioned, and many of them use different types of risks to understand kind of what's going on with an individual person. We typically talk about these as static versus dynamic risk factors. So the outcome or risk assessments that you might be familiar with typically include a mix of those. And just to get into what those are, static risk factors, I generally think of them as things that we can't change. So the number of times somebody has failed to appear in the past, the number of criminal convictions or previous incarcerations that they have, their pending charges, their current status in the justice system. Also, age is another good example, something that we cannot change, but is a reality and might contribute to a person's risk. And then there's the dynamic risk factors. And these are things that I think of as those places where we might be able to intervene to reduce the risk. So that would include things like substance use, behavioral health, residential stability, employment, kind of the things you're going to hear us talk about today, some of the ways that we try to intervene with our participants across our jurisdictions. So it's important to recognize that while somebody might be high risk, and we can't change everything about their situation, if we can be strategic about getting them into services that are voluntary, that can sort of get at those dynamic risk factors, we can achieve the things that, you know, my judge is worried about, court appearance and not getting rearrested, because we are actually addressing the underlying drivers of why they might have shown up on our doorstep in the first place. Next slide. And so we've touched on this just a little bit so far. So we are going to be really highlighting for you today what a needs-based supervision strategy might look like. I know that a lot of jurisdictions that surround me or that I'm familiar with, they're using more of a compliance-based supervision strategy, which focuses more on identifying the risk, the problems and the deficiencies that could increase an individual's risk. So we're identifying the risk, but the next question really is, well, what happens then? If you're just drug testing somebody, for example, you're identifying that they might have a risk of substance use, right? But does the actual drug testing itself increase their likelihood that they're going to go to substance use treatment? I think the research shows that no, it does not necessarily do that, right? So we're thinking more about, okay, we might know that there is some risk, but what can we do about it using a needs-based supervision strategy? So that has been ignored a lot. We know there's a much more compliance-based supervision going on right now than needs-based supervision. So we're really excited that there's a lot of interest in this because we have some ways to show you that how that can be implemented today. So needs-based supervision incorporates interventions to promote success among the greatest number of supervised individuals. So we are promoting success. We are there to help people. We're not there to just, make sure that they're meeting their drug testing requirement or their electronic monitoring requirement, some of those technical things that judges might use to do compliance. We are there to also promote success in very proactive ways. And I will hand it over to, I think, Domingo, you're up first on this one.
Yeah, I'm up first, and I'd like to answer a question that was delivered to the chat or to the question and answer. The question was, we all agree that words matter, given that we still have tons of jurisdictions that implement punitive pretrial practices and utilize probation officers to carry out pretrial services. Why does NAPSA continue to use the term supervision when referring to pretrial? That's a great question. I think right now, it's used to just develop that common language, so there's no misinterpretation of when we're addressing what is standard definition of supervision as someone released to a supervising community service officer or agent, pretrial officer, case manager. I think that's just something we use so everybody gets what we're referring to. I will say that the board, not just the NAPSA board, but also other groups that I'm a participant on. So that's the NIC, NetPen, the Executives Network, and even I need to throw a shout out to our partners with APPR. There has been a lot of conversation around language in the pretrial field, but I'd say for the sake of commonality right now, that's why supervision is used. I will say that we've locally, and I'll get into Pima County here in a second, we've had a lot of conversation and even kind of thrown it out to staff as to what do we call ourselves if someone is released, to us under our supervision or monitoring. Do we want to call ourselves a monitoring unit or a supervision unit, or do we come up with something completely different? So I mean, I think that's something that needs to evolve in the pretrial field. And once there's more common language around pretrial practices, I think that would be that'd be a good point for NAPSA to maybe change language in the standards. But thank you for that. That's a really important thing to talk about, especially for this kind of a session. So I'll get into Pima County. So we're a county, and before I start, because I really need to mention Terrence Chung, who is in the audience. Terrence Chung, I'm happy he's here because he was one of the individuals that I worked with hand in hand with. And I think all of us who are going to talk to you today and have developed strong relationships with stakeholders and have worked with our partners in the justice field in our own jurisdictions. And Terrence was a huge partner and helped develop a lot of things I'm going to talk about here. He was an advocate for us at the funding level and at developing policies and procedures. So I do want to mention his name because he's equally as equally should be attributed for the success of our programs in Pima County as I am. So that's a shout out I want to say. So Pima County is in Arizona. Our county population is just over 1 million. It continues to grow, inch up past 1 million. I will say that we Pretrial Services, our division, is standalone division of Superior Court. So we are not. I don't report to a probation chief. I report to the court administrator. We are the only county out of 15 counties in Arizona that is standalone at the moment. Everyone else reports to their probation chief or the probation unit. We're made up of two major functions. One is our initial appearance unit, and again, this is all to set the groundwork for what we're doing in Pima County. Which we are very happy to say that we employ universal screening. So we screen all misdemeanor and felony level charges if they're booked into the jail or if they're booked or they're taken to the jail pre-booking. Our assessment office, which is our initial appearance unit, includes a pre-booking function, which is aligned with some of the goals we have with supportive services. And what that means is we have pretrial officers who are stationed outside of the jail booking, who facilitate the release through a delegated release program. We use the PSA core tool, and then we have a supplemental behavioral health substance abuse screening tool. We use the ACOK tool, and then we use release conditions matrix to supplement our PSA core tool. That and APPR helped us create that matrix. We have a supervision unit, and again, I'm using the general language so everybody knows what I'm talking about. And then we're guided by our release conditions matrix. Our daily caseload, just so everybody here knows the context, over the past few years has been about 1,300 on average. Our daily population. Around COVID time, we shot up to over 2,000, and just I think over the last year or so dropped down to 13, and now we're getting closer to 1,400 again. So that's kind of like the situation in Pima County. Next slide, please. Regarding supportive service, so prior to incorporating some supportive services, I'm going to start by saying that we have not moved to wholesale supportive services in Pima County. We are still working in that direction. Before we started doing some work in supportive services, we use a standard community supervision model, so probation type model, where we had caseloads evenly distributed amongst all our officers. We did know risk levels of individuals, and we would supervise differently within those risk levels. But if I was a case manager back when we were not employing these services, I would have, let's say, 90 individuals, and maybe a third were low risk, the next third were moderate risk, and the highest, there was another third that were high risk. That's what we did, because that's what we always did, and we figured out pretty quickly that was not the best model to use. We focused on drug testing like a lot of jurisdictions did back then, and so I think some still do. We did try to make referrals to services, and we did have a higher technical violation rate back then. I might not get into stats too much. I wanted to talk about structure, but I'm happy to say that our technical violation rates dropped substantially since we moved to different ways to monitor individuals. Next slide, please. So the major programs that we use in Pima County that incorporate sort of services, and what I really want to talk about is, just kind of like the structure in pretrial and how we've implemented programs. So I really want to focus on that rather than outcomes. And I can talk about outcomes because we do have them and we do monitor them. So I want to start with saying which programs we are employing our new model. So our pre-book and release program is like one of the starting points. So those are misdemeanor individuals that are released by pretrial service officers prior to booking. And I would say about a year and a half ago, we received a lot of complaints, concerns about our release program, because our release program allows for individuals to be released pretty quickly. So, and there was concern that if someone's getting released by us really quickly before getting booked into jail, they were suffering from behavioral health substance use issues, and they're going to go right back to where they came from before the officer even got back to the scene. So I'll get into what that looks like here in a minute. I may talk about this at the end of the webinar. We have time, we want to save time for questions towards the end of the webinar, but if we have time, I'll talk about our steps diversion program, since it's not technically pretrial supervision or monitoring. And then really our jail population review committee in the county, which I'll address here in a second. Next slide, please. And there are a couple questions, so I will answer one live. Do we use the ACOK tool as supplemental information on the PSA? It is, so our ACOK tool is not factored into our pretrial assessment. So we use that to guide us in supervision going forward with individuals, whether it's in any of these programs I'm talking about or standard supervision. The judges don't receive the ACOK tool score. Again, I'm trying to adhere to like the NAPSA standards and then the model we're talking about here, which is meant to help us in pretrial determine how to best mitigate and reduce risk for that individual. And one more thing, in my county, it's called pretrial supervision. I only supervise pretrial cases, not probation cases. And if they don't get put on pretrial supervision, but are all still released from jail, they use a pretrial release. So it gets confusing. Agree. I'm going to concur with your comment. I have a picture here of what our transition center and pre-booking release program offices look like. So in the very back, and it's kind of small, but in the very background is kind of our old modular building. The building to the left, the dark gray building, is our new modular. We just walked through it today. And then to the right is the transition center. So again, our modular building is outside the booking process of our jail. And again, we are releasing individuals. We're setting conditions of release. We're acting in lieu of a judge. And then what happens is people get released and they're free to go. And so we're able to release misdemeanor charges minus domestic violence cases, because those cases statutorily must go to initial appearance hearings. What the transition center is a model for pretrial supervision that doesn't involve pretrial services, that incorporates some supportive, supervision aspects to it. So what we didn't want to do is create a situation in Pima County where we were starting to, and I'm going to use this for common language, supervise everybody, whether that's misdemeanors or felonies. We wanted to be able to create a handoff system where we had peer support specialists, we had individuals that were familiar with the service providers in the community, that were able to drive people to, if they needed to or wanted to go, and also keep all this stuff voluntary, right? We don't want to have to impose conditions of release for a disorderly conduct, someone charged with disorderly conduct, or someone who came out on a failure to appear for driving with a suspended license. No, we wanted to be able to create a system where pretrial, an oversight agency with pretrial officers, was not involved with people with lower charges or misdemeanor charges. So what our county did is they created this system where the county staffed with peer support specialists, with individuals that worked in that reentry capacity. They staffed the transition center, to try to match our hours. They're currently open Monday through Friday. We're open 7 days a week. We're open from 5 a.m. to 1 a.m. Every day. Transition center tries their best to meet those hours. If someone gets released by us and walks out the gate, they can go and leave the property. They're not restricted. They're not needing to go to the transition center. It's there if we encourage people to go. It's there if they want to go. And if they go, they can connect with the peer navigators who sometimes will communicate with us. But really what they're doing is they're trying to hand that person off to, hey, do you need anything from us? Here is a list of places you can go. Anything that you feel we can help you do, connect with. And so that's the model we have for our misdemeanor cases. We are not trying to create a new supervision program in Pima County, but we do want to implement some supportive services around the population. Next slide, please. And so this is from our partners with Pima County. Here's what their model is for their transition center that works with us for the misdemeanor population. And I mentioned that, we had feedback from our justice system and community partners. And again, I'm going to illustrate again, someone that got released by us, because it takes us 15, 20 minutes to release someone. So if an officer drives to our jail parking lot, if they're going to get booked in, someone's going to get booked in jail, that can take up to 1 or 2 hours, given current, booking staffing. Then they're sitting in a common area until court, which can take another 12 hours. Our process takes 15 to 20 minutes. We're doing some screening, we're quashing warrants if we need to, having an individual sign release conditions. The concern from the community was that person who might still be actively suffering from substance use or something, is going to go back to the same place, convenience store, locally owned business, residents. So again, this is what kind of fed the need for this kind of a process, which we wanted to do anyway. But this gave us the ability to move forward with a different system. One thing that the transitioner wants to really stress is that they are not treatment intervention. They are not there to start treatment. They're not there to tell people what kind of treatment they need to do. They're there to do is connect people to something that somewhere where they can do an assessment and probably get a little bit more direction in regards to whether or not they need treatment. They're a conduit to resources. One thing that we do partner with, and we're trying to kind of build our capacity here, is how do these people do, the people that choose to go to these services, how do they do when they're released and we have our court hearing scheduled? Are they appearing more often or not? Are they coming back to the jail more often or not? Are they picking up a new arrest down the road or not? I mean, those are things that we are trying to still collect information on. In fact, I think it's transparent to say that a lot of the people that do go to the transition center end up not appearing as often as they did in the past, as they did before. We think that's because we're getting the people that need the most help going to the transition center and probably in a more crisis, or they're the ones that are self-identifying as being further along in that change wheel, that they need those, that they've come to a certain point in their treatment that they need to re-engage. So that's where what we think is going on. And if that's the case, the county is still very supportive of the process. They feel like that then we have the treatment, the transition set up for the right thing in the right population. Next slide, please. And so here's where we get into kind of like the core changes we're making, and that's our jail population. I'm going to use our jail population review committee and steps diversion program as kind of a side conversation later if we get there. So our jail population committee is our sequential review program. And so what that is, and both these programs employ kind of the same model, and this is a model we're looking to replicate for our standard supervision population. But both these programs employ a cooperative stakeholder team. So for our jail population review committee, we have a judge is not present for our committee meetings. What we have is the prosecutor and defense who are in attendance. We have a pretrial services specialist. We have community service members, whether they're from providers or they're just individuals who are interested in the system. It's open to the public. And we have our county justice services team who staff this meeting. And essentially what happens is we have a list that's generated of individuals who have been in custody a certain amount of time, have not been posted their bond or been released, and their case has been indicted and ready to be seen for their first hearing in our superior court, which is essentially our felony court. And what happens is we review conditions as a group, and then the prosecutor and defense will agree on who should be released. So if there's a complication in the case, for example, the motion has already been filed, or there's another case pending that is let's say a violent case, and that person's held either preventatively or in a higher bond, that person will not be eligible for the JPR committee process. But if it's someone who struggled in the past to appear in court, who has maybe been showing signs of behavioral health, there was something at the initial appearance, the judge was not comfortable. They saw something that didn't make them comfortable releasing the individual. In certain of those cases, the parties will agree for this person to be released to pretrial services. The thing I'm most proud of is that they don't set treatment conditions, even though a lot of these individuals do have needs for substance use or behavioral health. Well, we've everybody's agreed, and this is kind of where we had to step in as a pretrial organization and say this is not appropriate, this is not best practices to set treatment conditions. They have given us the trust to be able to manage that. And I mentioned, someone asked earlier, what the screening tools we use, if they factor into the PSA. They do not, but they do come up for conversations in these meetings, where if this person, we identify this person may have needs, we talk about what that plan looks like. We are allowed to manage that plan, and it's not in court conditions of release. So I think that's the thing that I'm the most proud of what we've done here, is we've kept that as a separate, component, a mitigation strategy, supervision strategy, rather than a court condition of release. Now, as a pretrial organization, where I think that, we are going to go in Pima County, is we have a specialist, and then we have an officer assigned to this program, and then a student intern sometimes for our STEPS program, and then peer navigator or peer support specialists. I will say here, and this is something that I think a lot of jurisdictions that have large staffs may struggle with, is that getting everybody to kind of know what's available in for services in your community, getting to know what services are there, knowing the contact person, knowing the coordinator for that service provider, knowing which insurance provider the individual needs to go to or who they have. We thought that what we found out, not what we thought, we found out that that was really difficult to train across 20 pretrial officers that are supervising a large caseload. So we developed a system where we have a pretrial specialist assigned to these two programs, but particularly our jail population review committee, who is the point person for staff and the point person for these meetings. So they have the expertise to be the communicator in these meetings for the pretrial needs of this individual. Then they communicate with the individual themselves prior to release. They talk to the peer support specialists that are working with us, and then they talk to the community service providers regarding what's going on with this individual. If we need to know, we may not need to know anything about that, but that's been a model that's worked for us. It's kind of funneling down who is the person, is point person for the supportive services, and then the pretrial services officer can adhere. Their job is to make sure that defendants adhering to conditions of release, but also making sure that they get those court date reminders. So we're kind of just divvying up those and delegating those assignments to kind of work towards a better goal. And for us, that also helps because the specialist is the one focused on those treatment needs and assessment needs, and the pretrial officer who's communicating with the court is just making sure that individual is going to court and doing what they need to do. So that for us, that helps keep those two functions separately for individuals in these programs. As a peer navigator, working with the system, it's more so with our STEPS diversion program, but we don't employ, but we contract or have agreements with peer navigators. That one example is we have our behavioral health, our Pima County Health Department that funds a peer navigator with a service provider that works with our programs, or we work with peer navigators who are working with service providers in a different capacity to provide like in-court services for individuals that we're screening through these programs. So we've kind of got creative on how we resource that connectivity to peers. But again, that keeps that conversation separate from that pretrial officer who is managing that compliance with court conditions of release, and keeps that peer conversation separate and apart, so that it's not necessarily something we're documenting in our chronological notes. It's something that is happening outside of the court process, so we have that individual feel that there's confidence that they can speak freely with that peer navigator if they need to. And again, referrals, assessments, any treatment, that is all apart and separate from what gets reported to the court. That is not something that we are going to report isn't happening to the court, because that's not part of a court condition release. And next slide. Now, what are our future goals? And I said already, we don't do wholesale supportive services across all our caseloads. We try to do it with our standard supervision cases if we can, but I think we have to be more intentional about how that happens. So we want to implement the model I just talked about for general supervision cases. We're going to start focusing on meaningful interactions. So how do we engage with people? And I'm glad someone asked that question about supervision. There's other types of language we need to address, not just, what do we call ourselves, but how are we interacting with individuals that come to us and might have the need to, engage with a provider, might have the other needs that are not related to supportive services. That's our next step in our evolution with how we interact with pretrial defendants. And then obviously, and one thing I would stress a million times over is we do track outcomes. We have a very robust data management system. We have data entry staff. We create our own pretrial data. We don't rely on the court for that. And I think making sure we monitor the outcomes of individuals in these programs is going to be something we're going to do going forward. Now, I saw, and thanks to Kevin, who posted in the Q&A and probably the chat, our report from our transition center. What are the qualifications of the support services specialist? So we've gone back and forth on that. And so where we are at now is we really like to promote from within. So like we're hoping that we have pretrial officers who apply for that job, but we've in the past taken individuals who are either coming from a provider outside pretrial and I think we did that to kind of start setting the system up. But the last person we hired for a specialist just required some local pretrial supervise. It was an internal promotion, so they needed some experience locally with pretrial services. And then they also happen to have, for example, some prior work outside of our court. But it was a combination of the two. Going forward, I think we're hoping to promote internally, so it's just internal experience. And then Kevin's asking, Domingo, have you had conversations with your court about the supportive services model? Yes, we have. I think it's something that they support. And I will say that our court has been very supportive of the model because of the Jail Population Review Committee and our Steps Diversion Program, because they are our judges are engaging with that specialist. So they're hearing the expertise from that specialist and develop, kind of a professional trust in that individual. So they like the fact that there's one person or two people that they know are very well versed in this kind of area. They also understand the other part of it, which is are individuals going to court? What are we doing to monitor the other things that they're required to do? So I think they like that separation, but I think what they really like is that specialist has an engagement and they have someone to go to if a question comes up. And I'm speaking of the judges, and my court administration relies heavily on input from those judges about how court works for them, or how the process in the court works for them. Amber Olson asked, are the peers certified? They are certified through their service provider hosts. So the provider hosts that we work with do require their peers to be certified. And I believe that's the last of my slides. Yes.
Awesome. Thanks, Domingo. I am up next. So again, I'm coming to you from St. Louis, Missouri, to give a little bit of background about what has gone on here and how we've evolved to use supportive services in our model. Back in 2021, we launched the first ever pretrial services office here. So for a city of our size, it's kind of shocking to some people to know that we didn't actually exist before 2020. There was a bond office, is what it's called, that did exist for several decades and still does, and we are now incorporated with that office. So they were doing things already that are part of pretrial in many other places, like interviews in the jail, criminal histories that are provided to the judge, and a few other things. But there was nothing that would happen in our city after release. And so about 2020, the judges here were facing some outside pressure. We ended up, as a state, having some new court rules come out that limited our ability to use cash bail. It was very popular here in the city before 2020. But around 2019, 2020, we really shifted gears here due to a rule change. And so the judges decided to establish pretrial services here in the city. As a standalone agency like Domingo's, we also report directly to our court administrator and not to any probation or parole authority. We have no interaction with them except when we have some shared clients. So what we ended up doing, because the foray into pretrial services was a very cautious one, I'm sure some of you know what that's like to have judges or stakeholders who aren't really sure if they want to get into pretrial services and how far. My position was hired, but I was the only one in St. Louis City. And so that wasn't a ton to work with. So we got some stakeholders together and decided that we needed a little bit of extra support to show our judges what we could do with pretrial services. So we ended up applying for a Bureau of Justice Assistance Award, and we did receive that award, and it ended up running through 2024. What we ended up doing with that was demonstrating a proof of concept to our judges by partnering with two core community providers who started to immediately do jail inreach, court support, court attendance with participants, and to talk to judges and wraparound services in the communities where defendants live. And so over the course of the next 4 years, what we were able to do that I'll talk about here is demonstrate what we could do. And through that, we were able to secure additional staff directly from our court. So we got that buy-in, which resulted in funding as we slowly, piece by piece, showed them what we could provide to them as far as alternatives to incarceration and alternatives to cash bail, because there really was a vacuum here after that change happened. So what our office looks like now is 5 pretrial social workers. We really value that social work background because of our focus on the supportive services model. So our staff all either have some experience working in a social services setting prior to coming here, or they have an actual degree in social work and some really solid training in that perspective and that approach to our population. We also have, aside from 5 social workers here who are full-time staff, we have 5 community providers who are contracted with our court. They each have dedicated staff to the court and to our participants, and program space in the areas of housing, employment, mental health, and substance use. So we were really able to, over the course of 5 years, kind of build this out, starting with some initial hesitancy out to the full support of our court and our stakeholders here. More recently, we've also partnered with our statewide community behavioral health liaison program. That is a statewide Missouri program that is designed to disrupt some of the cycle of incarceration for folks who are struggling with substance use and mental health. So we have several in the St. Louis area. And as soon as they realized what we were doing with our formal community partners, they approached us and started to use actually the same pathways to get into our jail. I don't know if a lot of you have this issue, but it can be very hard for our partners to even get in the door of the jail. There might be requirements that are difficult to meet, or classes or training that they have to take, or just a staffing problem, and it's hard to get visits done. So we've had to work around a lot of that, and we found some really good ways to do that, and have invited other community partners in who we don't even pay to do this, but they've realized that we have opened the door to them to come in and find their population here and really work with them. And what this does for our judges is, to offer services, encourage pretrial release. I do want to emphasize here, and I will again, that ours are also voluntary. We do sometimes see judges want to order services, and I'm sure some of you see that as well, but we really, really discourage that. We don't report back to the court on those things, and so they can order it, but they know they're not going to get a report back on it because that's not our model. So we really don't see people pulled back into the jail on a revocation because they are not complying. So that is kind of a constant educational thing that we have to do with our judges. Next slide, please. So how did we start this? I did mention that we were able to secure a grant, which was incredibly helpful so that we could get the buy-in that we needed to secure actual budget space here in St. Louis City. But we also had some really significant help from community partners who back in 2019 started looking at the jail to do a needs assessment in the jail across the population there. So we didn't do this, but we were able to sort of piggyback off of them and use that to understand kind of what our population needed, because we didn't want to just bring in resources and say, we've done it, we've brought in our partners. We actually wanted to meet people where they were and what they were actually asking for. And so there was a needs assessment done in 2019 and again in 2021. By this group of partners out in the community that consisted mostly of nonprofit community social services agencies. And what they found was that people were asking repeatedly for the same things: employment assistance, emergency shelter and housing, therapy, psychiatry services, mental health services, and substance use. And so we decided right off the bat with our grant funding to focus on employment, parenting resources, transportation, and mental illness and substance abuse. And those are our 2 at the top there. Mission St. Louis is sort of our wraparound agency. They do a lot of employment, parenting, mentorship, financial assistance. They might pay somebody's rent to help them get housed. They help people get to court. They also get people into jobs and support them as they are trying to pursue long-term employment. And then Places for People was the other one that we started with, and they are a longstanding community mental health agency. They provide psychiatry and support services for severe mental illness and substance use. So from those two, those were our two original ones. We've been able to expand to offer housing, which is probably the biggest need we have here after substance use. So many people are struggling with housing. And so we partnered with two agencies to provide that, as well as another one to provide a different model of mental health services so we could offer different options to folks. The reasons that we do this is because our judges have realized, and we know that when these needs are not met, people are going to struggle to show up to court. They are going to struggle to not get rearrested during the pretrial phase. And so we figured that by intervening early and having these partners come into the jail actually when folks are still there, to start developing that rapport, developing that relationship, and then have them waiting for them on the outside to immediately begin services if that's what they are ready for, that we could improve outcomes for the court and show the judges that this was a better way to go than some of the more traditional compliance-based supervision that we easily could have started doing back in 2020 when this started going, right? It's a very common way to do it. It's the way that it has been done, but we had the opportunity to sort of right off the bat stress how important it was to actually address people's needs. Next slide, please. I am seeing some questions in the chat that I will answer before I jump into this next slide. So the first one is, has it been challenging tracking outcome data on supportive services since many times referrals are still pending at disposition? Yes, yes. It's very, we've found it difficult to track data, period, because we were so new. We actually didn't even have a case management system when I started. So that was one of the things that we had to get in place to even track our most basic descriptive data, let alone tracking some of the more complicated things like referring people to services and seeing what those outcomes are. So I will be totally honest with you that we still use a lot of spreadsheets for our supportive services because our case management system is pretty limited. We ended up with a system that, you know, does fine with some of the basics of pretrial and does allow us to send text messages and email reminders to folks about upcoming court dates, for example. That's very crucial for us, but it is not able to help us track our supportive services. So we have to do that in a different way. So we get pretty creative with it. We have several different ways that we do that. So we make it work, but yes, I wish it was a lot easier, and I wish there was a case management system that really met all of our needs, but so far I have yet to hear about one. So if anybody has ideas, let me know. The second question was, is Missouri a Medicaid expansion state? And the answer is yes. We actually, just as an aside, we as the people had to put that on the ballot and get it expanded, and we voted for it, thankfully, by a pretty nice margin. So we do have expanded Medicaid, which is obviously incredibly important for this population. So great questions, thank you. So to kind of illustrate for you very clearly how this works, how we operationalize this here, this is a graph that we designed as we were still in the Bureau of Justice Assistance grant phase, but we have continued to use this model now, even now that that grant is over, and we've expanded it to our non-grant partners who we've added in the years since we got that award. So as you can see, we start with jail screening. I mentioned that jail in-reach is a big part of what we do. We think it's really important to have that warm handoff. It's not unlike what Domingo was talking about with the transition center, where you have somebody available right there if that person wants to talk to them and is ready. So we have people coming in 5 days a week from our partner agencies to meet folks right after they've come into the jail. So our process is that somebody's arrested and they're typically seen by a judge within 24 to 48 hours. In the period between arrest and seeing the judge, we have them talk to somebody if they have asked for it, or if there's anything indicating that they might benefit from some supportive services in the community. After that, we do communicate to the court and defense attorneys who are going to be present at those initial hearings that these folks do have available resources on the outside if they were to be released. We have found that sometimes judges are so concerned about things like housing instability and substance use that they don't want to release somebody who otherwise would be appropriate for release, or who would be released if only they, you know, didn't report a substance use issue, or if that didn't appear to be a problem with them. So we've found that just by telling them that services are available and that somebody has met with them, that judges are more likely to be releasing them, knowing that there's somebody waiting for them on the outside to assist them with particular needs. I will say that does also run the risk of judges wanting to order people to supportive services because they know about it, right? And they're making a bond determination that day when they get the information. So again, education to the judges is crucial. It's got to be immediate and ongoing about how it's not best practices to order people to these services, and that they will not actually be getting information from pretrial services on whether they have followed through. So we've had a lot of luck with that. We kind of with our newer judges, we start right off the bat and we make sure that they know that this is how it's done, and that's been successful for us. So moving into the sort of court appearance bond hearing stage, I talked about that. After somebody is released, or even if they are not released, we might still be involved. Our partners may still be going into the jail to meet with them if they're not released, and working with their defense attorney on a treatment plan if the judge needed a little bit more information before they wanted to release them. But if they are released, they are receiving anything from transportation assistance, employment assistance. Everybody's receiving court reminders. Their caseworkers from our agencies might be coming to court with them. They typically are. And I want to highlight the importance of that too. I think Domingo mentioned this, that when our judges see people in court who they know and recognize and trust from our organizations and from the pretrial office, it does so much to encourage them to buy into this. They know that they're going to get the information they need, that we're here to support somebody. We're going to keep the judges informed about whether that person is going to be on time for court today. I ran into a division this morning because somebody we'd connected to substance use services called his caseworker and told her he was running late, and she let me know. And so I was able to avoid him getting in trouble for running late to court this morning. So again, they sort of know that we're in contact with somebody, and although we might not be providing detailed information about whether they are engaged in treatment and what kind of treatment and how long, they know that we are helping them, and that can make all the difference in the world for judicial buy-in here. And then we are also seeing that at case disposition, now that we've been doing this for a few years, we're seeing that caseworkers are showing up to those sentencing hearings and being asked to contribute to kind of how this person has done while they've been released. And as I hope we all know, when somebody is released pretrial, they're much more likely to have a better outcome when they get to the sentencing phase than those who are incarcerated for that entire pretrial period. So we hope that we're adding to that by somebody being successful in the community all the way up to case disposition, because they've had that extra support, they are much less likely to be given a custody sentence and end up back in the jail or in our Department of Corrections. And then just as a last thing, I mentioned that we have pretrial social workers in my office. So this entire process I've just laid out with you is just with our community partners, but alongside them working every day full time are myself and my 4 social worker staff who are, communicating with our partners here in the courthouse. We are also working individually with people who might have been ordered to supervision. And so we're taking a social work approach even with those who are ordered to supervision. And so we might be linking them to these same partners later in the process. We might be supporting them in other ways as well. And just to highlight some things I've already said, our services are voluntary. We make sure they are low barrier. Some of the things that we do to accomplish that is daily jail inreach. We also, every day at the court on Thursdays, we have our partners come to be available to those who are walking in. Our partner agencies are all located in the city, and they're in the neighborhoods where a lot of our participants live. So those services can continue even after the case is over. So it doesn't terminate just because their case is done. These services don't require any payment or insurance, although many of them do help our folks get onto Medicaid. And so they can continue even if a case is disposed of. Our social workers, while we have our community partner program, our social workers, again, they might be executing supervision requirements. We collect a lot of data here, as I've talked about. We have some transportation assistance available out of our office. We send court reminders. We connect our pretrial participants to our community partners and other services. And then we also appear in court, again, maybe to share just limited information with judges and attorneys. We're not getting into whether they're complying or how often or whatever it is they're doing. We're just giving the bare bones information that we need to. I do want to touch briefly on electronic monitoring. I mentioned this in the introduction. This is one way our jurisdiction, despite moving away from cash bail, which is hardly ever used now, our jurisdiction has moved towards electronic monitoring, which is kind of a concerning development here. I think it's part of having that vacuum where judges relied for decades so heavily on cash bond that when it was taken away, they moved towards supportive services, but also towards electronic monitoring, especially for people that they perceive to be high risk, right? So our social workers here, and our agency caseworkers, one of our core functions, I would say, is to help mitigate the harm of the inevitable issues that happen with electronic monitoring. We have many, many technical violations that arise from that. And so a lot of what we do is to educate the judges on the limitations of the technology, to intervene when there's been a mistake, because we do oversee the electronic monitoring vendor that we have. We don't actually do it out of our office, but we have a vendor. And so a lot of our work is quality control, frankly, and then harm mitigation to kind of help our judges understand that this is not going to be the best fit to reduce risk for almost anybody. Next slide, please. And I do have a question up here from Gabriel Nims. Do our pretrial social workers carry the same caseload profile as a regular pretrial officer? So that's a great question, and it's a kind of a complicated answer. So what we tend to see with our judges is that when they order somebody to supervision, they are, as a rule, almost a higher needs person coming through the system. We've sort of trained them that is what our strength is if they are worried about somebody's risk because of a behavioral health need or a housing need or any other number of needs-based issues that are going on with a person, that is where we can really shine and help increase their court appearance and help increase their pretrial success. So we don't distinguish between caseloads. So all of our pretrial social workers have a caseload that is a mix. I should add here, we don't use a risk assessment. So we're not breaking down by risk either. That is not something that our judges wanted to do, was use a risk assessment. It's a longer conversation. But so, yeah, we do not do kind of what Domingo laid out of sort of, breaking down the caseload in certain ways. We take who the judges order, we educate them on kind of the best fit for that. And then within our office, we sort of manage them, occasionally switching people to caseloads based on the strength of that individual pretrial social worker. And then I have another question that popped up. Do we have case managers for electronic monitoring? This person is a pretrial electronic monitoring agency, and we've had a lot of success on the pretrial aspect. Our vendor has staff, so I don't think they call them caseworkers, but they specifically deal with all of the monitoring and all of the reporting to the court. We only get involved pretty much if there's a problem. And so we are in contact with them every day. We are intervening very regularly. But no, we do not have anybody dedicated in that way to electronic monitoring because we contract that out. So I'll get quickly into our outputs and some of our outcomes that we've been able to measure. So it's just some of the numbers of things that we've been able to do. In 2024, our partners entered the jail 661 distinct times to meet with clients or potential clients. On average, we have about 29 people voluntarily opt into services with our partners every month. Our partners appeared at 411 court hearings throughout the year, going with the clients because it helps them, to be accountable, to be there, to support them while they're there in a very, sort of anxiety-provoking environment, or to talk to the judge if that is going to be helpful to that person. And so I mentioned several times already, it's so important that we're visible and that the judges can see. They always feel better when they have somebody they can ask a question of and they feel like they're getting the information they need to make their decisions. We provided over 800 distinct transportation assistance events. So that is bus tickets, gas cards. Some of our caseworkers do give rides to court and to other appointments. And then I do want to highlight that some of this is a calculation of finances, right? Like not every jurisdiction is going to be able to just immediately start paying for additional staff to do supportive services, or some of the tangible items that might be provided in a supportive services environment, like shelter, housing, transportation, hygiene, cell phones, some of the things that we know help with pretrial support. So what we do is we communicate, how much we're spending versus how much we could be spending on jail, which is almost always more expensive. And if we can prevent some of the revolving door, we're saving quite a bit of money. So there's a few jurisdictions in Missouri that are doing a really good job of this cost benefit analysis. So I want to highlight, and I'll get into a little bit more of the numbers in the next slide, I think, that we're spending about $200,000 this fiscal year on those things, but we think it is 100% worth it. Because those folks, if they were returning to the jail or had never been released to be involved in supportive services, would be costing a lot more. Next slide. So here is some more on the finances. So we estimate that we spend about $2,300 per participant per year. Some people were also monitored by electronic monitoring during that time, which is about $2,400. So even if you put those together, somebody is experiencing both of those in a year, that still pales in comparison to the very high jail costs in St. Louis City, which is about $36,500 per person per year. So if we can keep people out, even though we're spending what feels like a lot of money sometimes to our judges, when we have numbers like this to show them, it really helps bring home, that this is worth it, and helps alleviate their concern about the cost. Next slide. And yeah, of course, it really matters what our outcomes are. And so I'll just quickly go through this. All pretrial monitored population is on the left there, with our recidivism percentage and our court appearance percentage. So as you can see, the four to the right of that, Mission St. Louis, PFP, SPC, those are our community providers. So we track individually based on agency. You can see right off the bat that our court appearance is much higher. When we have our caseworkers involved, they are getting people to court. Our no new charges or recidivism rate, they're roughly the same, a little bit lower on some of them, a little bit higher. And so I think what that shows us is that we're not doing any damage at the very least. And because we think our population is really high, we know our population is high needs. I suspect those numbers would be a lot lower if we weren't involved. It would be lovely to track that in a more rigorous academic way at some point. So we hope to do that. But we're really happy with these outcomes. And again, it's very important to show our judges kind of, we're doing all this work, but what is happening with court appearance and rearrests. So I think that might be it for me.
Thank you, Sarah. So I want to share with you a little bit about Cass County, Indiana, to give you a little bit of the history. I am a rural jurisdiction in northern mid-Indiana of about population of 38,000 people. So much smaller than Domingo or Sarah. And our pretrial release agency was originally established in 2018 in response to jail overcrowding and Indiana's pretrial release initiative that spurred in partnership with NIC and our Supreme Court ruling with Criminal Rule 26, now 2.6. We employ a risk assessment. We use the ORAS, or what Indiana calls the IRAS, and we rely heavily on risk-based release decisions. So a supportive services model, as Domingo and Sarah have highlighted, is not really what happens at that initial release decision, but it's what happens afterwards. What do we do during that time on pretrial supervision to help people have the best chance of being successful? And beyond just reforming pretrial practices in Cass County in Indiana and implementing a risk-based release decision process, which we're very good at, we had the local objective. Actually, my judge, since she was a prosecutor and before becoming a judge, wanted to eliminate the disparities in access to support services that was in our rural jurisdiction. So a lot of our community-based alternatives to incarceration, or even our community-based services, required people to be serving executed terms of sentences to get access to key services such as behavioral health, therapy, and substance use treatment. So what that created is not only a disparity of people entering pleas to exit jail, which is what we commonly hear about in the pretrial world, but also a disparity in accessing those key resources. So we wanted to solve that by monitoring best practices. So pretrial release here in Cass County is voluntary, and any engagement in supportive services, whether it's socioeconomic, substance use, or behavioral health, it is also completely voluntary and never court ordered by the judge. And their ability or want to engage in services, that motivation is never a factor when determining their eligibility for release. So our goal when we were wanting to employ this model and expand our pretrial release from a compliance-based kind of bare bones operation to a needs-based model was to incorporate supervision that was intentional and that included voluntary support referrals to address the common barriers that we were seeing, which was vocational employment, housing, substance use, and behavioral health. We've really implemented an integrated supportive services model to answer the needs of a rural community where access to services is really kind of spread out. But I love the question in the chat that Domingo got at the beginning of this, is that what do we call ourselves? Is it pretrial supports? Is it pretrial supervision? Are we officers, social workers, or case managers? And part of the shift for us to more needs-focused supervision and away from a compliance model was that we didn't want to be referees where we were just focused on preventing things from going wrong and looking at the deficits. We wanted to help clients overcome barriers and to coach them with being successful. So we identify ourselves as coaches, and part of that shift in our mindset is due to our partnership with Justice System Partners and Dr. Lovins in integrating the coaching referee model for change. So even if someone has no special conditions of release and they're not engaging in supportive services, the way we talk to and interact with clients, language does matter, has a direct impact on the outcomes when it comes to making all their court appearances and remaining arrest-free. So we really believe that the mindset and approach behind every interaction is equally as important as the supportive services and the supervision strategies that we employ. One thing to keep in mind in the premise, everything that we say here is that we define pretrial success as remaining arrest-free and making all your court appearances while on supervision, and that any supportive services is always voluntary. When we talk about tracking the data and outcomes, because completing any type of treatment program or engagement in service, whether it's obtaining employment or a stable residence, is not a condition of release. We just want to capture that engagement and celebrate that client taking that first step. When we were partnering with people, we were really passionate about ensuring equal access to treatment and eliminating disparate treatment. So everything we offer is at no cost to the clients. And much like Sarah, it can continue even after case disposition to promote continued success, whether that client is released back into the community or transitions to another stage in the criminal legal system. By integrating supportive services in-house and within our department, we really reduce barriers to engagement. So in a rural community, it can be a lot for an individual to check in if they have reporting requirements, make court appearances, engage with behavioral health and substance use. That's a lot of transportation resources, a lot of time away from employment, and extra childcare. So incorporating that, much like Domingo, as close as possible to our office and even in our office, allows us to eliminate that redundancy in reporting and engagement and brings that all in one spot. And what we've seen is that it's really boosted our engagement rates and in turn has had a positive outcome on court appearance and remaining arrest-free. A key to doing that and to being successful with this model was really expanding our resource inventory. And our work here is really never finished. In a rural community, it's hard to check all those boxes and do that. But our primary needs, when we actually surveyed our clients, our public defenders, our judges, and our other stakeholders, what are the primary needs that you see when you're interacting with our clients, whether it's while they're still in the jail or they're out in their community. And the biggest one for us was behavioral health and substance use. And in a rural community, it's really hard to provide that equal access. Not everyone has insurance. I would say about 50% of the people that we interact with doesn't have access to that. So we were able to leverage some grant funding, some opioid settlement funding to actually hire a therapeutic services director who works alongside my pretrial staff and has some clinicians under him who provides those behavioral health supportive services that not only focuses on individual counseling and substance use treatment, but also medication management, and provides that all within the capacity of our office. Like Domingo, we also incorporate peer recovery specialists so that they can stay true to the values that they have and their code of conduct. They are supervised with our local behavioral health provider and are governed by that and are a little bit separated from us, but they provide that warm handoff and someone walking through someone through the system at every step and every interaction of the phase. And that really helps bring humanity back that and employs that holistic approach. We find that when people feel valued and they feel seen throughout the process and someone is accompanying through that, that can really help calm that anxiety, which is normal in the criminal legal system, and really center that person and set them on a path forward and help them be successful. We also have employed a lot of interventions around socioeconomic barriers, and that includes transportation assistance and vouchers, housing assistance, partnering with our employment agencies and educational resources. And we've been really lucky that with these socioeconomic barriers that we were able to capitalize the resources and funding that our community partners had for that, and they're willing to contribute in kind to the program when they can. And we would be remiss if we didn't mention our partners with inpatient treatment. So while we work a lot with our inpatient treatment providers, again, always voluntary, with that, they really go the extra mile in providing transportation. Being rural, they come to us, sometimes a 2-hour drive to help pick up a client and take them to treatment, bring them back for all their court appearances. So that person does not have to choose between complying with their court obligations and with getting the services they need to be successful. Some of the strategies that we've used to increase voluntary supportive services engagement is, I can't emphasize enough, kind of as Sarah has mentioned, training your staff and having a more social services mindset. For us, it's a lot of training in the coaching model and taking a more view of, instead of looking for what's going wrong or compliance focused, punitive focus, to how can I support someone in being successful. We've also worked a lot with motivational interviewing and ACHAI to employ that in trauma-informed approaches. We really want to bring back the humanity and a holistic view of how we interact with people and employ some strength-based strategies and ECMS techniques. And what we have seen is, even if someone doesn't have special conditions of release, that when we take this mindset and this approach, that we're able to build trust and rapport with our clients, and they're more apt to engage in services outside of court order that are going to help them be successful, not only with the pretrial success, but within their life afterwards. And just as we talk about behavioral health and behavioral science, we find that clients are more successful when we do things with them rather than to them. So looking at the data, and I don't have it here to illustrate to you, but what we saw when we compared the voluntary engagement and supportive services versus the engagement of those that were court ordered on post-conviction is that pretrial, with a voluntary approach to engaging people in treatment and in programming and other resources, had a higher engagement rate and completion rate than post-conviction. So we were able to really increase that buy-in with the judges, that when we give clients agency in choosing what client services they can participate in, and that they have the freedom to choose to participate or opt out of services at any time without any report to the court or negative reflection, that they are going to, on their own, engage in that support service to center them and help them live successfully within their release condition. And that's really the role of my staff or my coaches, is what strategies do we need to employ when we're working with them outside to help them live successfully within their release conditions, which is remaining arrest-free and making all their court appearances. We've collected data from the very beginning. Anyone who's heard me present before knows that we are very reliant on our data to guide our outcomes. And when we were doing this, much like Sarah's represented, we started small. So we didn't have a full-blown treatment division right away. We started with some interns from our behavioral health provider and was 1 day a week before having a full-blown 4-day-a-week services integrated into our office. And we were able to measure the data and measure the outcomes and what people were engaging in to allocate those resources moving forward. This impact on our outcomes has been amazing. So during the first year when we were kind of piloting this, we were really excited to see a 25% reduction in new substance use related arrests. That kind of showed us that this was worth digging deeper into. And since launching the therapeutic division in the fall of 2024, there was a 20% increase in voluntary program participation rate. So if you're wondering, are clients in the pretrial phase motivated to engage in resources? Do they want to be successful? Do they want to center and stabilize their situation and improve their lives? The answer is yes. And what we've seen looking at the data, and you'll see in a couple graphs I have in the next few slides, is that clients who voluntarily engage in these services are 20% averaging more likely to avoid rearrests and appear for all their court hearings. We measure what we call a voluntary supportive services participation rate, and we just measure engagement rather than focusing on completion. And we find that 75% of clients voluntarily participate in some form of supportive services during pretrial supervision, whether that's vocational or housing resources or behavioral health. And we also want to broaden a little bit, instead of just looking at traditional recidivism measures that look at remaining arrest-free and court appearances, but what are the intangible benefits to our clients and our community? And we like to look at those measures. While that's not the primary focus of pretrial, we do like to look at that and kind of celebrate that intangible impact that we're having on our community. And what we're seeing is that 78% increase in employment at the end of the supervision period compared to when someone starts pretrial services. And as Sarah highlighted, is that when people are released, they are better able to advocate for themselves, and the statistics show that they have better outcomes. So we're seeing that 12% of those who complete pretrial supervision have their case dismissed, or they enter into a diversion agreement, and less than 1% return to incarceration versus receiving an executed sentence in 2024. And to kind of give some background to that, in Indiana, we are a cash bail system. So most of the misdemeanors and those lower risk, lower level charges post financial conditions and don't have any reporting on top of that. We are largely felony based, about 70%. So showing that 70% of those less than 1% return to incarceration is a big number to look at. One of the things that we're really proud about is that we move very quickly in Cass County, because we really want to mitigate the negative impact of pretrial incarceration and center that person as soon as we can and stabilize that situation if they are wanting to engage in services, so we can put them on the right path moving forward. And this is a little bit of timeline of what that looks like in Cass County. So we try to not only expedite release and get people in and out of the jail as quickly as possible, but we also try to expedite that condition and that warm handoff to services. And that starts very early for me at 4 a.m. I am in there doing those pretrial outcome assessments. And those reports are done on anyone who was arrested in the past 24 hours. And by 7 a.m., that information, and again, supportive services is not part of the first three little bars that you see here. That happens afterwards. But all that information is to all the parties by 7 a.m. At 8 a.m., we're having that hearing. It takes a little bit, as Domingo mentioned, to get someone released from the jail, but usually by 10 a.m., people are released from the jail. They're reporting to our office, and if they want to, they can engage in those services to stabilize their situation and to help them be successful, whether that's seeing one of the counselors or social workers we have on staff, engaging with a peer recovery specialist, or getting connected to some housing resources. They can do that all. Oftentimes it happens within 4 to 6 hours from the point of arrest to release. So we move very quickly because we believe the more that we can shorten that pretrial detention and connect people to services, the better outcomes that we are going to have. And when we talk about resources, like what Sarah has mentioned, we have found that as we've employed this model and we've invested more and more in supportive services and we broaden our resource inventory, that we've been able to decrease court-ordered special conditions, especially electronic monitoring. So knock on wood that for the past 3 years, I have not had anyone ordered to pretrial electronic monitoring as a special condition of release. And we've been able to take those resources and instead reallocate them to supportive services so we can continue offering all these resources free to our clients so we keep that equal access to treatment. We've monitored these outcomes. We're very lucky that we have a case management system that serves up these outcomes to all our pretrial agencies in Indiana, but we're able to monitor those outcomes and what is the impact of what we're doing. We can drill down by service provider or by barrier to pretrial success, but what you'll be able to see here is interaction with pretrial services versus financial conditions alone really does, you'll see the green bar there, has much higher success rates. So whether that's our coaching mindset for those who are lower risk and have no special conditions or are not engaging in supportive services, to those who are heavily engaged in behavioral health and voluntary treatment, we average about a 20% increase in success across appearance, public safety, and return to incarceration rates. And we can break it down even further to those who are on supervision, those who engage in supportive services, and those who don't, because remember, it's always voluntary, and we can continue to see that higher rate of success. So with that, we were able to really validate what we're doing and gain that support of our stakeholders. So one thing that's unique about Cass County is less than 25% of my funding comes from grant funding. We are locally funded, and that allows us to sustain our program moving forward and reserve those grant funds for those in our state who are just starting up pretrial programs. But by continuing to look at the data and outcomes, we can prioritize the resources for those that are truly in need for our clients and ensure the sustainability of that moving forward. With that, I'm going to open it up to questions with everyone. There's none in the chat right now, but if you want to come off mic and answer us some questions, I'm going to put up the slide where you can scan a QR code, and we would love to hear your feedback. We also have a slide at the end that I'll switch to that has all of our email contacts if you'd like to answer us a question privately or set up a time to talk with us. Each one of us would love to take the time to spend that to chat with you if you're interested in developing supportive services. But we just thank you for your time and spending the afternoon with us and learning a little bit more about the supportive services model of supervision.
Again, I know that we only have about 2 minutes left, so if there are any questions, please feel free. Otherwise, thank you so much to the panelists who did an outstanding job. Also, if you're still with us, please take the time to fill out that survey that Hillary popped up there. And otherwise, hope everybody has a great day. Again, we do still have some time here. If there are some questions, looks like we might have One, yeah, I can answer that. So, will the recording be available on NAPS's YouTube channel? Yes. Typically, that takes me just a day or two to get back up there. And as well, we can make the slide deck available for those that are interested. And normally, I send that out via the NAPSA email list. And so, you can, if you're a member or if you are getting our emails, you will receive it. Just taking another minute or two, though, if there are any other questions. All right. Seeing none, then just again, thank you so much for taking the time to be with us today and to join our webinar series. Thank you very much to Hillary, Sarah, and Domingo for doing an outstanding job with this topic, and hope to see you all very soon. Have a great day.